Injury Prevention for Shin Splints by Sadie Laster. Shin splints, or medial tibial stress syndrome, otherwise known as true shin splints, are common for all kinds of people, especially runners, jumpers, military members, people with osteoporosis, which is weak bones, and are more common in females. Shin splints essentially are the damage that can happen from overuse to the tibialis muscles that attach to the tibia. The edge of these muscles may begin to pull away from the bone, and the injured muscle and bone can become inflamed from this. The mechanism of injury is overuse or a change in activity, such as intensity or duration. The muscle that is affected with medial shin splints is the posterior tibialis muscle. The symptoms are pain along the shin bone, pain that goes away with rest, inflammation of the shin bone, weakness, tenderness, and mild swelling. You need to be very careful, as shin splints can turn to a stress fracture or tendinitis if not treated for long enough. Go to a doctor if your pain does not go away after rest for a long time. Shin splints affects many people, up to 3 million people a year. Up to 70% of runners are impacted by this as well, and 35% of military recruits. I did my program on Emily Banks, a cross-country and track athlete who's been affected by shin splints for about a year now. Shin splints were especially prevalent for her during the track season when she was running on harder ground, which I'll get into later, and are prevalent now during cross-country season, especially as she exists in daily life. I did baselines on Emily to see if I could get her to decrease her amount of pain, increase her amount of reps, and increase flexibility. I wanted to decrease her pain, obviously, so that way she can do more, which is proven by the amount of reps she can do, I thought, and increase her flexibility, as this can cause more movement overall. She starts pretty average in her range of motion, but that's pretty good. Keep in mind for shin splints, if you do a change in training, such as distance, hills, or intensity, you need to do this very gradually as you don't aggravate your shin splints. Keep in mind the type of terrain as well, such as beware of concrete, hard grounds, and tracks, as they can cause much more pain. Emily was affected by this when she ran a marathon last year and had to run on hard ground, and her shin splints were acting up very badly. Also, if you have flat feet, you need to do more than just stretching and strengthening exercises. This is very important for Emily because she has flat feet. I performed the navicular drop test on her, which proved that she did have flat feet because she had over a 1 centimeter drop in both of her feet. So she will need to seek out insoles, as I mentioned on the next slide. Some treatments for that are taping, which can help you give you more support and pull that pain away from the side and keep that muscle attached on there. Ice, especially ice massage, as massaging is really good for treating that muscle. And heat is a bit of a tricky one, as you don't want to inflame that more, so don't do it in the beginning. But once swelling has gone down, use heat pads and heat, because it can relax tight muscles and reduce pain, as well as increase circulation in your legs, which can make you more flexible. NSAIDs, or anti-inflammatory, can help with pain right away if you have that, and can just help more movement. Don't rely on them too badly, though. And as I mentioned before, shoe support and orthotics. This is very important, as I said, if you have flat feet or high arches, as you will need some more support than just the normal stretching and ice. You need to get a sturdy heel counter and cushioned insoles that provide you good stability and reduce your impact load. You should be assessed and fit by a professional, although you can get them over the counter if you really need to. Compression and elevation can also help with pain and being more supported overall, but those are some treatment methods besides the program I go into. To start up, I started with some warm-ups. I tried to make them dynamic as possible. That way she could get properly warmed up. This is very important to make sure you don't hurt yourself or tear anything. I started with shin stretches, hamstring stretches, quad stretch, side-to-side lunges, and eccentric calf raises. Most of these are moving stretches except for quad stretches, but I wouldn't hit all the muscles that we're mainly going to use. But that is kind of similar to my actual program, that is of the stretching program, which hits all the lower leg and calf muscles, such as the gastrocnemius, soleus, Achilles tendon, and tibialis anterior muscles. Her specific program was that she do the stretching on the days that she does have running and practice, and she do the strengthening on the days she doesn't. So this is what she goes through daily. For some other stretches she has the toe drag stretch, kneeling stretch, chair stretch, Achilles tendon stretch, calf arch stretch, and her arch rollout. It's important to stretch the Achilles with the arch rollout and the Achilles tendon stretch, which you can see right here, because if the Achilles gets tight, it's harder for the anterior extensors to dorsiflex the foot, and if that arch is really tight, the foot can pronate and the arch collapses, which is flat feet, which causes shin splints and puts a strain on her lower leg in general, so it's important to stretch this out. I gave her some strengthening exercises to make sure shin splints don't happen to her as much, because this can really prevent her. If her muscle is strong, it won't tear away as much. So I had her do heel and toe walks, towel curls, heel drops, single leg glute bridges, calf raises, bent knee calf raises, and soleus wall squats. She did pretty well at those. She said she didn't really like the single leg glute bridges, but, she put up with it. For cool down, I had to do some static stretching, such as butterfly, hurdler, lunge, pigeon, and downward dog, which she did well. It's important to cool down. That way you don't get more injured, and that way you can really give your muscles a bit of relaxing time before you go straight into another activity. Her results were pretty good for pain decreasing. They decreased for most of her activities, such as calf raises, jumping jacks, and toe raises. Squats, they stayed the same. She doesn't really have pain with that. Strides, they went up, but that's because she said that activity was pretty difficult for her. And she had just gotten back from a blood drive where they said she didn't want to do much movement. And so she said she was feeling weaker overall just the whole week, but that was unrelated to my program. For her doing more reps, that went down quite a bit. Like I said, that could be related to the blood drive. She said she was feeling kind of slowed down. I hope that in the future, if she did this program, which she said she might, it would improve more, but more information is going to be needed on that to see if that actually worked. Finally, for her flexibility, this was good. She went up quite a bit in a lot of her movements, which I thought was nice. And hopefully that'll mean that she won't get shin splints as much, or that she'll be more ready to move if she does have shin splints. As I said before, she was feeling sick the first week of the program, and she had a blood drive, so that could be affecting my data. Hopefully it's not, but we'll see. With the program, she said it was a 9 out of 10, which is pretty good for me. It was effective, and she had no improvements to say. I felt pretty good in reducing her pain besides the strides, but she said she struggled with that. And I did increase her flexibility, which is good. But like I said, I will need to see more about increasing those reps. Thank you, and hopefully you'll pick my program.